Let's grab one off, boys. Who's that knocking at my door? Never heard that knock before. Is it evil trying to get into my room? Who's that tapping at my window? Who's calling me to go to a place that is filled with dark and gloom? Well, this life that I'm living seems so unforgiving.
Welcome everybody to Hawaii Health Partners' third annual membership meeting. Thank you guys very much for being here tonight. I hope you guys appreciated the non-Everly brothers. Those were the Cleverly brothers. Wasn't that cute? So did anyone catch out what they were singing to? Anyone know that song? Ken Robbins, you know that song? It's Who's That Knocking at My Door? So there's kind of a theme here that we're going to try to hit on, and you'll hopefully get that as we move through. So I'm very happy, like I said, that you guys are all here tonight. I wanted to acknowledge a few guests, like Jenny Pressler. Jenny, where'd you go? Thank you, Jenny, for being here and joining us tonight. We also have some prospective members, and also the people who are wearing leis are our HHP board members. So thank you guys very much for all that you do. I know you've got busy schedules, so it is truly with appreciation that we have you here. So as Hawaii's first accountable care organization, we're leading the way focusing on value and not volume and transforming healthcare. This is really what our vision and mission is to create a healthier Hawaii and be the leaders in healthcare transformation. So tonight, we're going to reflect on some of the major accomplishments and lessons that we've learned over the past year, and talk with our doctors who are leading those efforts more than anyone else. No such administration, no HMSA talk, just really our doctors showing the way. It's also we kind of allowed it to go a little bit longer tonight in terms of getting started because there's a lot of great dialogue going on. It's wonderful to have you guys being able to create time to interact and build on the relationships with old colleagues and new colleagues as we start learning together and shaping the future of the organization. So what I'd like to do is have you take out your cell phones right now. Could you do that, please, all of you? Every one of you, because we're going to need this. We need the technology. So first thing when you take out your cell phone is please put it on vibrate. But don't turn it off. Don't turn it off. Because the second thing is I want to get you to be ready for this poll everywhere. So on your desks or on your tables is a instruction. So techies, help the non-techies, okay? And what I want you to do is dial in, follow the instructions, dial in, get yourself set up so that we can ask some questions later and get some audience feedback, okay? So also at the end, hopefully we'll pick up speed as we go through, but at the end we'll have a Q&A session and microphones are going to be available at the end of the program, and we'll have our panel up here of all the speakers tonight in order to answer some of your questions and get into some dialogue. So with that, I would like to bring up Mr. Ray Vera. Ray, it's our Hawaii Health Partners, Hawaii Pacific Health President and CEO. He's going to share a few thoughts with you. Thanks, Ray.
All right, when he said there were no administrators talking, I thought he had canceled my portion of the evening. So I will keep this brief. You're certainly not here to hear me talk tonight. There's I think, a great program as Dr. Livide outlined. But really what I want to share is, first of all, thank you for being here tonight. Thank you for being part of Hawaii Health Partners. But more than anything, thank you for what you're doing for this community and making Hawaii Health Partners a success. I will tell you, when we started this, when we started envisioning it a little over 3 years ago, we could have never envisioned the kind of outcomes that we've already begun to see and that we're seeing as an organization over the last 2 years. And you're going to see a lot of that information tonight. You're going to see the progress that you all have made. And so I just want to say congratulations and thank you for all that work and for all that effort and for serving our community the way that you do. Now, I got to tell you, as I look at this sort of from my vantage point, when we started Hawaii Health Partners a little over 3 years ago, and we started envisioning this, I had a lot of confidence that we were going to be successful. Again, I didn't know that we were going to be as successful as we have been, as fast as we have been, but I had no doubt that we were going to be successful because we certainly had the right level of physician engagement, we had the right level of physician leadership, we had the right people in place, and to be quite honest, the reason I knew that those things would be successful were because we had the chassis of Hawaii Pacific Health behind that in supporting it. As you remember, we started this as a physician-led, professionally managed organization, and I had a lot of confidence in those things working together and the ability to be successful. But my viewpoint is quite different today. It's the success today is not because of the chassis that Hawaii Pacific Health provides. It's because the engine that you all provide. It's because what you're doing to lead this organization and to drive success, and doing that through focusing on the right things, truly improving quality, truly bringing value to our patient community and our community at large. And I will tell you, that is so much better than anything that I could have hoped for as I look forward and really thought about how we were going to apply that chassis of Hawaii Pacific Health. So I could not be more pleased at the success that we've had. And you're going to see those results. Jared's going to share those with you. And I think the challenge that really lies ahead for us is how do we go and take that forward and really go about transitioning from the kind of model that we have now that, again, it's still largely volume-based to a more value-based system, and really start driving cost out of the system and start reducing utilization and truly doing it in a way that is truly going to create that value proposition through providing the highest quality of care. And how do we, as a group, supporting one another, enable that? How do we bring the payers along to make sure that they're standing by our side as we do that? And I will tell you, we have to start moving in that direction more aggressively, but strategically and deliberately, to make sure that we're all stepping in that direction at the same time with the right support mechanisms and the right tools to make sure that we're successful. Because success isn't just about all of us coming and being able to celebrate in this room once a year. It's about the impact that we're able to make in the lives of our patients and across the breadth of the community. And when I think about, we rebranded ourselves this last year and we refocused our mission, and we talked about creating a mission that really focuses on creating a healthier Hawaii in the broadest sense. We changed our keys to success to focus on the broader patient experience, to focus on population health, employee well-being, physician engagement, community partnerships, and being able to fund our own future based on all these initiatives. And I will tell you, the only way we're going to be able to do that is through our work together and through truly continuing able to move that ball and bring that value proposition through all the things that I just talked about to this community. And I tell you, I have no more confidence than anybody else can do this in this community than we can. And so, again, thank you for your leadership, thank you for your commitment, and thank you for all that you've done to make, I think, the progress that we've made such a success. So thanks. Hope you enjoy the rest of the evening. Aloha.